The IEP process. If a parents believe that the child might be eligible for special services, they can ask to the child's teacher for a referral or evaluations. Parents usually give authorizations for the child evaluations orally or in writing. After 60 days of parents' consent, the school district must utilize various tools, procedures, and a complete evaluations of the child's areas of concern. The result of these evaluations, along with the parent information, will benefit the decision if the students qualify for special educations and related services. To decide if a student is qualified for educations, the multidisciplinary team meets to pronounce if the student has an identified disability, and if so, to provide support with special educations and related services. The school has to ensure also that one or both of the parents participate in the meeting. They have to notify parents with enough time. Also, once the students turn 16, if the team considers the student's participation important, then they have to send an invitation to the student. But if the parents have difficulty in assisting to the IEP meeting, the IEP team must secure the parents' participation by a phone call. The IEP team must write understandable components to maintain the focus of the unique tailored instructions to meet the unique needs. It must include the present levels of academic achievement and functional performance, a clear description of all of the goals, a description of how the student is performing toward the annual goals, a statement of the special educations and related services and supplementary aids and services that the students will receive, and a statement of the individual adaptations that is necessary to measure the academic achievement and functional performance of the child. The presence of the following person is essential as a part of the IEP meeting: the parents of the student, the homeroom teacher, one of the special educators, a knowledgeable representative person from the district, another person who has special knowledge or expertise regarding to the child, and the presence of the child with disability whenever appropriate. The communications between the teachers, the school, and parents, guardian, it is crucial. By having these, parents can monitor their child's progress throughout the school year. Parents can talk regularly with their child's teacher and spend some time in the classroom if possible. By keeping in touch with the school, parents will be able to assess how the child is reading, writing, and other goals that have to meet the student. The ethical principles and professional practices standards guide the teacher toward the best route of giving the students high level of respect and the highest benefits they can receive from their education. The educator have to individualize the instruction, variables, and use evidence-based practices. Also, the educator have to identify what options will best meet the needs of their student and use periodic assessment to measure the progress of their students to make sure each student is receiving the best accommodations for their education's goals. Thank you.